Welcome back, everyone. Today we're diving into the world of pulmonary hypertension, or PH for short. We've got two medical journal articles here, and whether you're a healthcare pro or just someone wanting to understand PH better, we're breaking it all down for you.
Absolutely. It's definitely a topic worth understanding.
So first things first, what exactly are we talking about when we say pulmonary hypertension?
I
It
just,
sounds kind of intense, right?
it's actually simpler than it sounds. Basically, think high blood pressure, but instead of being all over, it's specifically happening in the arteries of your lungs.
Okay, so not your everyday blood pressure issue.
Okay.
But why are the lungs such a critical area when we're talking about high blood pressure?
Well, think about how the heart works for a sec. Your heart's right ventricle, that's the chamber responsible for pumping blood through the lungs. Now, imagine that pump facing constant high pressure. It's like trying to push a car uphill all the time. It puts a ton of strain on the heart.
So it's not just a problem in the lungs, it's impacting the heart directly too.
Right, it's a chain reaction. That strain can actually make the heart muscle thicken and enlarge. And one of the articles made a great analogy. They compared late diagnosis of PH to being stuck in a massive traffic
So
jam.
stressful, right?
Ugh, tell me about it. Especially if you're already running late.
And that's the thing with PH. Early diagnosis is key. It's like having a GPS to navigate around that medical traffic jam. So recognizing those early warning signs is crucial. Okay, so what should people be looking out for? How do you know if it's something more serious than just being a little out of breath?
That's where things can get tricky. The early symptoms of TH can be pretty sneaky, easily mistaken for something else. Both articles pointed to shortness of breath during exercise as a really common one.
So if you're huffing and puffing a bit more than usual on that morning run, could that be a sign?
It definitely could be, especially if it's new or getting worse over time. But here's the catch. As pH progresses, those symptoms tend to escalate.
And not in a good way, I'm guessing. The articles mention some pretty intense symptoms that pop up as pH worsens.
Yeah, we're talking about fainting spells during exercise, chest pain that comes and goes, even signs of heart failure. It can really impact your quality of life.
Wow, that's a huge jump from just feeling a little winded.
Yeah.
So early detection is important not just to avoid those scarier symptoms, but also because it probably makes treatment more effective, right?
You hit the nail on the head. And speaking of diagnosis, the articles we have here really dig into the different ways doctors pinpoint pH. It's pretty interesting stuff.
So we've talked about those red flags, those early symptoms, but how do doctors actually go from like, that's weird, to, okay, this might be pulmonary hypertension?
It's a great question, and it's not always a straight line, right? It's like detective work, piecing together clues from different tests. And these articles, they really get into the nitty-gritty of that process.
Okay, so walk us through it. What's usually the first step?
So often, after getting a good understanding of the patient's history, symptoms, all that, doctors will turn to a pretty common test, the echocardiogram. You might know it as an echo.
Oh yeah, the echo. Those are for all sorts of heart things, right?
Yeah.
How does it help with pH specifically?
So basically, an echo uses sound waves to create a picture of your heart in action. It's painless, which is always a plus, and it lets doctors see how the heart muscle is doing, the size of the chambers, if the valves are working right, all that good stuff.
So with pH, are they looking for specific things, like damage from the high blood pressure?
Exactly. One of the key things they check is the right ventricle. That's the part that pumps blood to the lungs.
Right.
If it's enlarged or looking strained, it could be a sign of pH.
Okay, that makes sense. But one of the articles mentioned that an echo isn't always a slam dunk for diagnosing pH, right?
You're right, it's not foolproof. It gives us really valuable info, but sometimes those echo findings, they could be from other conditions too. So we need more pieces of the puzzle.
Which brings us to the right heart catheterization. I'm not going to lie, that one sounds a little intimidating.
Yeah, it's got a mouthful of a name, that's for sure. RHC for short. It might sound scary, but it's actually very common and really safe. They basically insert a thin tube, a catheter, into a vein, usually in the neck or groin area.
Hold on, all the way to the heart. That's wild.
It's pretty amazing, and what it lets them do is directly measure the pressure inside the pulmonary arteries. Those are the vessels that take blood from the heart to the lungs. Direct measurement, that's the key here. An echo can't quite do that.
So the echo's like a glimpse, and the RAC is like
Different.
zooming in.
Exactly. It gives us precise details about the pressure and blood flow in the lungs. And with that info, we can be a lot more confident in diagnosing pH. And that's crucial because the more accurate the diagnosis, the better we can tailor the treatment plan. And these articles really hammer that home treatment is key for managing pH effectively.
So it's like We need to know exactly what we're dealing with before we can figure out the best way to handle it.
Right on. And sometimes it takes more than just the echo and the RHC. The articles also talk about things like chest x-rays, pulmonary function tests, even CT scans. It's about putting all those pieces together.
Like a medical puzzle, kind of.
You got it. For instance, a chest x-ray might show if the heart is enlarged or if there are changes in the blood vessels in the lungs. Both can be signs of pH, but like the echo, they could point to other things too.
Okay, so more clues to consider. What about those pulmonary function tests, the PFTs? What do those tell us?
Those are all about how well your lungs are working in general. They measure things like lung capacity, how much air you can breathe in and out, and how well oxygen is being transferred to your blood.
So important for making sure we're not mistaking pH for another respiratory problem, right?
Absolutely. We want to be sure we're on the right track. And then there are electrocardiograms or ECGs. Those measure the heart's electrical activity. And CT scans, they're like super detailed x-rays. They give us a really clear picture any structural changes in the heart and lungs.
Wow, so many tools to help figure out what's going on.
Right. And which ones we use and when, it all depends on the person, their symptoms, their medical history. It's about finding the most efficient and accurate way to get that diagnosis. And once we have that puzzle solved, the focus shifts from detective work to, okay, what's the plan? How do we manage this?
So we've covered how you diagnose pulmonary hypertension, but I'm sure the big question is what happens next? What can you actually do about it?
Well, the good news is treatments for pH have gotten a lot better.
Uh,
But yeah, it's not as simple as here's one pill, you're all set.
The articles mentioned a whole range of meds, pills, inhalers, IV drugs. That's a lot to keep track of.
It definitely can be. Deciding which medication or sometimes even a combination is right, it depends on a few things.
Like what? What factors come into play there?
Well, the biggest one is how severe the pH is. Someone with really mild symptoms might be okay with just one medication they take orally. But if it's more advanced, you might be talking multiple meds, maybe even some that are intravenous, through an IV or even a pump.
So like different levels of intensity depending on how serious the pH is. Makes sense.
Yeah, exactly. And then another thing we look at is what's actually causing the pH in the first place. Is it idiopathic, which basically means we don't know the exact root cause? Or is it tied to another condition, something like scleroderma or lupus?
Ah, so the treatment plan might need to tackle that underlying condition at the same time.
Exactly. Got to address the root, not just the symptoms. And then, of course, you have to consider the patient's overall health, other meds they might be on, how well their body handles different treatments. It's really individualized.
And I bet it gets even more complex if someone ends up in intensive care. One of the articles mentioned that. What are some of the challenges with pH meds in the ICU?
Oh, for sure. Managing pH medications in the ICU is like next level. You've got patients who are critically ill, maybe on a ventilator, can't even swallow pills. You might have to switch up how a medication is given, like from a pill to an IV form of the same drug, or even temporarily adjust the doses.
Wow, so you're constantly adapting, but you have to make sure that pH is still being treated effectively.
It's a real balancing act, yeah. It needs close monitoring, clear communication between the whole medical team, the patient, their family if they're involved. Got to watch for drug interactions, side effects, be ready to change the game plan if the patient's condition changes, which in the ICU can happen quickly.
Really highlights how important having a specialist team is, huh?
Oh, 100%. You might have pulmonologists, cardiologists, maybe even a rheumatologist if there's an autoimmune thing going on. Teamwork makes the dream work.
Totally. Well, we've covered a T-on today, from those sneaky early symptoms all the way to how pH is treated. As we wrap things up here, what's the main thing you want our listeners to take away from all this?
If I could stress just one thing, it's that knowledge is power, plain and simple. The more you understand about pH, the warning signs, the better equipped you are to advocate for yourself or a loved one. Early diagnosis, proactive management, those are huge E for living well with pH.
Perfectly said. And that wraps up our deep dive into pulmonary hypertension. Hopefully you feel informed, empowered, ready to have those important conversations with your healthcare providers. Until next time, everyone, stay curious.